Okay. Hello. My name is Olivia Allison, and on behalf of the Center of Excellence for Hospitality Resilience, I am pleased to welcome you to the Ensuring a Resilient Event Business series. Today's module will focus on strategies for event risk reduction, which will deal with risk and crisis management for events, as well as exploring the various legal issues surrounding the industry, license, permit, and insurance requirements. So once again, thank you so much for joining us today. This series is intended to support small tourism and hospitality businesses looking to create, sustain, and grow their event management offerings. This 6-part series is brought to you by the Center of Excellence for Hospitality Resilience, a joint initiative of Temple University's School of Sport, Tourism, and Hospitality Management and Temple Small Business Development Center. Today's module is a 60-minute session with a 30-minute Q&A where you can ask questions via the chat box or the Q&A function in Zoom. And then following the module, all attendees are welcome to join our open office hours where you can ask today's presenters questions about topics covered in the session. Those office hours are held from 3:30 to 5:30, and they will be in a separate Zoom meeting. So you'll be able to turn your camera on and unmute yourself and ask those questions directly to today's instructor. And I will post the link to register for those office hours in the chat box if you haven't had a chance to do so already. But in the meantime, I'm going to turn the floor over to today's presenter, Ira Rosen.
Great. Thank you very much, Olivia. I appreciate it. And welcome, everybody. Thank you for choosing to spend a really lovely day with me. At least it's a lovely day here in New Jersey in the Philadelphia area. So hopefully it's a lovely day where you are also. So if you appreciate you taking the time to learn a little bit and to discuss, and again, in the chat box, feel free to ask any questions as we go, this concept of how we start to reduce risk. This is a really fascinating topic for me. I am not a teacher by trade. I'm very fortunate to teach in this industry. But one of my specialties really is event risk management, something that I spend a lot of time researching, spend a lot of time talking about, spend a lot of time working with colleagues. And it's a conversation, particularly in this day and age. And we will spend a lot of time in this hour talking about COVID-related risk reduction, because at the end of the day, that's the gorilla in the room, as it were. But this is a constantly changing topic. Literally, I gave this presentation 4 weeks ago. Everything has changed in 4 weeks. Literally, I prepared the slides for this probably on Tuesday or Wednesday. On Thursday, the CDC made a completely different announcement. So when we get to the topics that we're going to talk about when it comes to COVID risk reduction, recognize that we are in an ever-changing situation. We're in an ever-changing situation with regard to any risk management and any risk reduction, but we certainly are when it comes to the world of COVID and dealing with how we come out of this pandemic. And literally, for those of you in Philadelphia and not in other parts of Pennsylvania, and on Philadelphia, the health department is supposed to make another announcement, probably changing what we're doing. So the best advice I can give you, and again, you will certainly learn some strategies about general risk and COVID-related risk over the course of the next hour or so, but please make sure that you are current. This is a constantly changing topic, constantly changing discussion, and what I say to you today may not be, in fact, the case when we get to Monday. Again, the strategies for how we reduce risk stay the same, but the actual implementation of some of these strategies will change. And you'll notice the deliberate use of the word reduction here, okay? Event risk reduction. It doesn't say event risk elimination. And that's very deliberate. The choice of the title was one that I thought about a lot, because in the world of events, we can never 100% eliminate risk, because we live, when we go back to the world of live events, whenever that might be, sooner rather than later in a lot of cases, we can never eliminate the risk. There is always going to be some risk. There is always a risk of somebody getting sick, whether it's from COVID, which hopefully is a reduced risk now, or from food poisoning or alcohol poisoning, or there's a risk of something bad happening at our event, whether it's naturally occurring, a thunderstorm, and whether it's made by human beings, somebody threatening to rob us, somebody threatening to do harm to us, you know? So again, it's about risk reduction. It's not about risk elimination. So be aware of that. And again, recognize that information on this changes all of the time. So this is a really important disclaimer. I am a university professor. I am also an event producer and consultant. I am none of these other things. I'm not a lawyer. I'm not an accountant. I'm not a health professional. I'm not a scientist. I'm not an insurance agent. So if you have very specific questions that affect your legal status, your financial status, your health status, your insurance status, please make sure that you speak to those people directly. I know a lot about all of this stuff, but again, I don't want anybody to think that this 1 hour session is giving you legal advice or financial advice. It's about recommendations, it's about things to think about. And again, as I said, this is an ever-changing situation. So make sure you are dealing with and consulting with your particular tough word, jurisdictional authorities. If you're in the city of Philadelphia, we know who it is. If you're in Montgomery County or Bucks County or Chester County, all of those counties have different sets of regulations. And again, this is literally changing every day. I downloaded a report on Monday that was put out, and let me make sure I get the right names. It was put out by the Event Safety Alliance, of which I am a member, and the National Independent Venue Association, in partnerships with a number of other organizations. And it was a reopening checklist for the live entertainment industry. This came out on Monday. It has changed because in this document, they talk about the fact that in most jurisdictions, face coverings are still required. So literally, as soon as you print this stuff, it changes. So make sure that you are staying very current with what's going on. So this word crisis, because I teach undergraduates and graduate students a lot, we all throw words around. Crisis is one of these words that we're not really sure sometimes what it means. So I downloaded this definition because I think in so many ways, it describes what we've dealt with over the past 14 months. And again, recognize that prior to the coronavirus pandemic, there were other risks that we faced. There were other crises that we faced. But I really think that this slide really talks about what we've all been through together over the past 14 months. Sequence of events at which the trend is, especially for better or for worse, is a determined turning point. So I think everybody will agree that 14, almost 15 months ago now was a huge turning point in the event industry, no matter what segment of that industry you are in. The second one, the condition of instability or danger leading to decisive change. Yeah, there's been a ton of instability. There's been a ton of danger. If you look back when we were in the midst of this, whether it's first wave, second wave, third wave, pick your wave, people were afraid. People were understandably afraid. People are still afraid. No matter what the government says, no matter what the CDC says, and I believe in the science, the virus has not gone away. Okay? It is mitigated. The risk is reduced specifically for vaccinated people, but you don't have to look far to see that in India, for example, it is raging. Thousands of people are unfortunately, sadly, and tragically dying every day. Canada is still locked down. Okay? So far, so good. The United States is doing better with vaccinations. We'll talk about vaccinations a little bit later when we get into it. But we are still in a condition of instability. And then the third one, which to me really describes what we've lived through, a dramatic emotional or circumstantial upheaval in a person's life. And you don't have to go very far to know somebody who has been directly affected by the pandemic, whether directly through loss of a job or loss of a loved one, or indirectly, loss of substantial amounts of income, even if you have a job, your income has been reduced. Hopefully none of you have gotten sick or none of your family has gotten sick, but absolutely dramatic, emotional, and circumstantial upheavals in so many people's lives. So as we look at risk, as we look at crisis, recognize what we mean by it. So this is something that we're hearing a lot of now, this concept of, is there a light at the end of the tunnel? And the phrase that I like to use to describe the situation that the world of events in right now is one of cautious optimism. But again, recognize it's great to be optimistic and forward thinking, but we also have to be cautious because we don't want to make the mistake of this speeding train coming towards us. And again, yeah, there is light at the end of the tunnel, and I'll talk about hope a little bit later in the conversation, but we also have to be cautious in what we do. So this slide talks about the fact that just because the government says it's okay doesn't mean we should be doing this. We have to have a lot of conversations about how we move forward and when we move forward, okay? Because from a risk situation, there's certainly the risk of people getting hurt at an event, sick at an event, damaged at an event. There's also that consequence of financial risk. And we've seen this a lot in the restaurant industry. And again, it's getting better because capacities are going up. Some restaurants, when it was 25 to 30% capacity, were like, you know what? I can't make enough money to pay my staff if I'm only 25 to 30% open. Now that it's getting better, that it's 50, 60, 70%, maybe it works. It's the same thing with events. What is that situation where an event is making enough money to justify what they're doing? In the world of event risk reduction, recognize that you have to make sure that you are financially stable at the end of the day. And I see so many events going, woohoo, let's throw the doors open and let people in. Although part of me is like, I'm on board with that. Another part of me is think it through, because this situation, this crisis, has put events into a situation where they can rethink themselves, they can reinvent themselves. And they really want to start to think about, maybe we don't go 100% live. Maybe we stay in the world of hybrid for a little while. And in addressing the world of hybrid, some quotes that I want to share with you, okay? And I'll excerpt them. I'm not going to read all of these. Again, the slides will be available, through a link. The recording will be available. Olivia has already posted that, or will post that throughout the course of this hour. But here's some interesting quotes. This talks about, again, that the global pandemic has changed the everyday lives of people. The events industry, global trade has been affected. We have to recognize that some of the things we've done during the pandemic are going to be around even after it's over. COVID-19 has brought everything to a halt, sent people scrambling to find sources of income. Moving forward is going to be anything but easy, okay? We have to look at three things: making events safe and clean in regard to COVID, continue to become innovative in the virtual world, and to be flexible as possible. Third one, even though the future of the events industry is changing, I believe the industry is ready to make its comeback within the upcoming months. But again, virtual events, meetings, and conferences were never expected to be part of this new normal. But I do believe hosting meetings, events, and conferences virtually are part of the future. And this one I like a lot. Virtual and hybrid events are here to stay. So who are all these four people? I am sure I can pretty much guarantee none of you have heard of them. And do you want to know why? These are undergraduates that I taught this past semester. So these are 20-year-olds, 21, 22-year-olds. These are your audience. These are the people that are coming to your events and will come to your events in the future. So recognize that people in their 20s, although they are excited about going back to restaurants and going back to bars and going back to events, they are being thoughtful about it. They don't want the same old, been to this event, yeah, I'll go back, but I want it to be different. I want it to be new. I want it to be innovative and exciting. So these are the audiences of the future. And that's why I decided to take some of their quotes and share them with you, because these are the audience. This is where we need to be in order to continue to thrive. So the next couple of slides, I'm going to throw some statistics at you. Again, when I show statistics, again, in this class, there certainly is no test, but even at the undergraduate or graduate level, when I show statistics, it's not about memorizing those statistics. It's about looking at trends and seeing where things are going. So the next 4 slides come from a publication called Event MB, Event Manager Blog. If you don't subscribe to it, by all means do so. You can get full access, I want to say for under $100 a year. They post daily stuff. It's owned by Skift, which is a travel online publication. Great information. And this is a survey that was done. This was released just about a week ago at this point, but it shows some really interesting statistics to me. And again, they used commas instead of decimal points. So, I downloaded it and used their slides. So again, giving their permission here. But this was done, again, it was conducted in March. So obviously 3.8%. And this was, let me just give you the statistics. This was 740 responses. It was released on Monday, the 10th, in a publication called The State of the Event Industry. 91% of their 740 respondents were event planners, and the other 9% were suppliers to the industry. So again, we are today, it's May, it is May. So we are in the middle of the second quarter right now, right? January, February, March, April, May. Yes, we're at the end of the second quarter. Third quarter starts with June, which is only 2 weeks away. So again, minimal expectation of the second quarter being strong. Third quarter, fourth quarter, pretty good, but first half of 2022 still wins out. So again, there's a lot of organizations that are out there who are saying we're not going to host in-person events until the first half of 2022. Not surprisingly, biggest obstacle for resuming events, safety. And recognize when I talk about safety, not sure if these respondents were thinking about safety the way I do. Everything that we had to do prior to COVID, from a guest safety perspective, we still have to do. And on top of that, we have to add some layer of pandemic response. And again, that layer of pandemic response is literally changing on a day-to-day basis. It also says attendees and stakeholders. So the word stakeholder is a very broad, definitive kind of word. It talks about anybody who is associated with your event in any way, shape, or form. So we all know what attendees are, or guests, or customers. Use whatever word you want to fill in there. But stakeholders are people like you. If you have a staff, your staff are stakeholders. If you have volunteers, your volunteers are stakeholders. If you have sponsors, your sponsors are stakeholders. If you have suppliers and vendors, those vendors and suppliers are stakeholders. So recognize that everybody basically who has some level of interest in your event, doesn't have to be a financial interest, is a stakeholder. So safety of our stakeholders, by far the number one obstacle. And again, safety was something we thought about a lot before COVID. You have to think about it even more going forward. Travel limitations is still an interesting one because there are still a lot of travel bans. International travel bans, as of today, still exist. I do some consulting with a client that does a lantern festival in Philadelphia. Obviously didn't do it in 2020, but the 4 years prior to that did that. And most of the people, there is a holding company in the US that has their administrative staff people, but all of their technical and operational people come from China. So the biggest hang up right now for doing that event in 2021 is less safety, because we kind of got that figured out. But people from China still cannot travel to the United States. So what we're hoping to do is they're literally going from China, they're trying to get a visa to go to Cambodia because people from Cambodia can travel to the United States. So again, travel limitations. It also affects if you're booking talent. I have a lot of friends who work for Irish and Scottish festivals that bring people over from Ireland and Scotland to perform at their events. Right now, those performers, as of today, Monday may change, but as of today, they can't get here. Lack of financial viability, to me, I would have put it higher, physical distancing, et cetera, et cetera, et cetera. Which of the things that are making people confident? Vaccine. Vaccine has been the number one. This survey, this is the fourth time this survey has been done. Vaccines at the beginning were not that high, but now they are. That is the number one reason that the CDC has changed the current regulations, because no, we have not reached herd immunity. Herd immunity by, I'll throw out a word that I did not know what it meant before COVID, but I'm really familiar with it now. Epidemiologists, woohoo, people that study those things, have basically said herd immunity is somewhere around 70% of a population. Now, we're nowhere near 70% yet. The United States is about, as of this morning, 55% have gotten at least one shot, and about 40-ish have gotten two shots. And remember, fully immune, well, not immune, but fully vaccinated means 2 weeks after your final shot. So if it's Johnson & Johnson, which is a one-shot vaccine, it's, let's say I got and I am fully vaccinated completely, but let's say I got the J&J shot today, 2 weeks before I am considered fully vaccinated. Moderna, same thing. That's a double dose. The Pfizer one is also a double dose. Okay. Government permissions, again, to me, that should have been a little bit higher, because we cannot do events without governmental permission, as we in Philadelphia know. Testing, et cetera, et cetera. But again, certainly vaccines. And then once we go back to business, and this reflects a little bit about what my students were saying. When we go back to business, will our event be, and again, you could select multiple options, but again, hybrid events. 14, 15 months ago, there were hybrid events, there were virtual events, but I don't think, and I don't have a crystal ball, and I don't pretend to be able to foretell the future, but I'm pretty sure before we went into the world of pandemic, this would not have been the response. But almost 70% of the respondents say hybrid is going to be what our event looks like. Now, recognize hybrid is a combination of virtual and live. Virtual itself, not so much, because events in virtual, really, really hard. Hybrid works. Virtual is really hard, because in virtual, like today, there's very little engagement. Yeah, you can chat me up in the chat box, but I can't see you. I can't hear you. It's tough to be engaged. I don't know. Well, I do know. But theoretically, I don't know if there's 50 of you out there or I'm talking to myself. Okay, so that's virtual. In hybrid, there's a combination. There's more interaction. There's more engagement. So in the world of hybrid and virtual, the two biggest challenges are lack of engagement and lack of monetization. People can't figure out how to make money. Many events are going to be smaller in size. Capacities are still reduced as of today. So in the city of Philadelphia, sporting events, as of today, the stadiums are at, I'm probably misquoting here, but let's say 50 to 60% of capacity. On June 11th, which is not that far away, they go to 100%. Are the stadiums going to sell out? Probably. There's a lot of pent-up demand for sports events. Is the pent-up demand for live events the same? I don't know. I do think events are going to be more localized, because, again, people may not necessarily want to travel. And again, shorter in time, same size, virtual, all numbers that, are relatively minuscule. So how do we create this safe and secure environment for everything that we're doing? And again, recognize that all of our stakeholders have to be secure. Our guests, our employees, our volunteers, our sponsors, our production people, our vendors, all of them have to be safe and secure, and recognize that safe and secure is not just about COVID. It's about all of the other things. So those of you who go to live events or went to live events or going back to live events, when we go back to live events, all of the protocols that were in place prior to the pandemic will continue to remain in place. So if you had to get your bag checked, guess what? You're still going to have to do that. If you had to get, either walk through a magnetometer and take all of the metal stuff out of your pockets or your handbag or your backpack or whatever it is you were carrying, you're still going to have to do that. And at least for the foreseeable future, there's going to be a second level of safety screening. Because again, as I said, the COVID virus has not disappeared. It's been reduced to the point where people are feeling safer, but it's not gone away. So as I said, obviously I'm a university professor, but I still do a ton of consulting work for lots of festival and event entities around the country and certainly in Philadelphia and in the greater Commonwealth of Pennsylvania. So I do some work with the Philadelphia Flower Show, which opens in just a couple of weeks on June, looking at my calendar, June 5th. Their rules and regulations are changing, but there are still COVID protocols in place. Are they going to require masks? Well, depends what the city of Philadelphia does. Are they going to have enhanced cleaning? And again, these are some of the things that we're going to look at on this next slide. Are they going to have masks? As of today, they are still going to require masks. Now, this is a large outdoor public gathering. They are limited to the number of tickets that they can sell. They're doing timed tickets to control that access. But when you take out all of the people that are existing that are going to be there, the union labor, the production staff, the vendors, the volunteers, all of those people, they have 2 timed session blocks. Don't recall exactly what the times are, but there's a morning block and an afternoon block. Their capacity as of today is 11,000 per block. The guests will probably be required to wear masks. Do I know that as a fact? No, because they're meeting with the health department on Monday, where some of this can change. Now, their back of house staff, and again, those of you who are in the industry understand back of house versus front of house. Back of house are all the workers. So the people like me, the consultants, the vendors, the food and beverage staff. As of today, we still have to go through screening. We will be asked those questions when we check in. Have you been out of the country? Have you been out of the state? Have you experienced a fever? Have you been around anybody that you think might have coronavirus? No. You get a wristband, you put your mask on or back on, and you walk into the site. Is that going to change? Every indication that I have, which again can change, as of yesterday, is they're going to keep a lot of these protocols in place anyway, just to make their guests feel safe. So we will probably be masked up. We will probably have temperature checks. There is going to be some level of capacity monitoring. There will absolutely be, I'll skip over physical distancing for a minute, but there will absolutely be enhanced cleaning. There will absolutely be a lot of hand sanitizer and hand washing stations. They are, because of the audience that they attract, they are they're outdoors. So again, portable toilets are the outdoor thing. 99% of the people that I know in the world eat portable toilets. These portable toilets some of these are nicer than the bathrooms in my home, okay? Hot and cold running water, air conditioning, flush toilets, expensive as hell. Okay, really, really expensive, but that's what their guests expect. And they are paying people, the company that they're contracting with will be cleaning those portable toilet trailers on a very regular basis. So all of us in this business are going to have increased costs for all of this stuff, because guess what? Hand sanitizer is not free. Hand washing stations for outdoor events are not free. Enhanced cleaning is not free, because guess what? Pretty rare you're going to get a volunteer who's willing to clean a portable toilet, even if it's a nice trailer. That's not typically in the volunteer job description. So everything that we're doing in here costs money. And when I said earlier, just because you can doesn't mean you have to, becomes a financial consideration, because the cost to do all of these things, very, very expensive. Trust me when I tell you that the cost for the flower show for housekeeping and cleaning and portable toilets and hand sanitizer is really, really expensive. Okay? Physical distancing, that's still a little bit up in the air. You know, there's this conversation about if you've been fully vaccinated outdoors, you might not have to physical distance or social distance. I hate the word social distancing, because that means I don't want to be your friend. I do want to be your friend, but just want to stay a little bit away from you, okay? We don't know what this means as of today. I know I'm vaccinated. I know staff people at the flower show who are vaccinated. The entire staff is vaccinated, as a matter of fact. I have absolutely no idea if a guest or a patron is fully vaccinated. I have no way of knowing that. So I personally am going to continue wearing a mask for a while, even if the governor or the mayor or the CDC says I don't have to. I am making that personal choice. And your guests may make that personal choice. So if you're running a staff, how do you determine mask, no mask? Before we started, I was having conversations that I'm seeing, you know, restaurant owners and vendors and store owners having this dilemma about, you know, because again, in New Jersey and New York and Philadelphia, mask mandates still exist. So let's say I drive in from a place that there is no mask mandate, and I walk into your store, into your restaurant, into your bar, and you've got a sign that says mask required, and I walk in and I'm from Maryland. I don't think Delaware has the mask mandate. Up here, I live at the Jersey Shore. Connecticut doesn't have a mask mandate. And I say to you, I'm sorry, you need to have a mask on. I might get an argument. Okay, so arguments lead to other kinds of things. So the whole physical distancing thing gets to be interesting. Contact tracing, I think, is going to be reduced. Testing, you know, again, as vaccines go up, testing goes down. And this last one, this whole conversation about requirements of vaccinations is going to be a political nightmare for the foreseeable future. And again, this is not a discussion about politics. Your politics are your business and not mine. But recognize the politics associated with vaccinations. Recognize the politics associated with mandating vaccinations. There are states who have said you cannot, absolutely no way, require somebody to get a vaccination. So in Florida, there's been an ongoing controversy with the cruise industry, because the cruise industry, which has a ton of ships coming out of Florida to the tune of multi-millions and billions of dollars in economic impact, okay, is saying you cannot come onto our ship without showing proof of vaccination. Whereas the governor of the state of Florida has said you cannot require that. Okay, some of the big cruise lines are saying, you know what, we're not going to dock in Florida anymore. That would mandate a multi-billion-dollar loss of income to Florida. So again, politics is a part of these vaccination passports. And when we get into the world of international travel, Can individual countries require you to show proof of vaccination? Individual countries can do anything they want. So if you're going to a destination wedding in Italy, Italy can say to you, not without proof of vaccination. Okay, so it has a direct impact on the events industry. Universities some of them are mandating vaccinations. Temple University has not made that. Well, for now, they have decided not to require that. Sports venues, are they going to require proof of vaccination? Some are, some aren't. Event venues, wedding venues, catering venues, restaurant venues. Whole interesting conversations about what's going to happen. So whatever happens, what we need to do is we need to make sure that we are talking to our customers, whoever those customers are. We want to communicate on an ongoing basis. What are we doing? How are we being safe? How are we complying with whatever it is we are complying with, whatever that may be? What are the screening procedures, if any, we're going through? And then consistent messaging. Whatever we're saying to our customers, and again, this applies across the board, not just to COVID. Recognize, as I said at the beginning, 45 minutes ago at this point, that everything we talk about today applies to COVID, but it applies to all of the other risk measures that we had to put in place before COVID. So if we were screening our patrons, let's go back to prior to March 10th of 2020, and we were, let's say you went to a sports venue prior to that date. You could only carry stuff in a clear plastic bag. You had to go through mandatory metal detectors. You had to go through, in some cases, a search, a pat down. Those measures were communicated prior to your arrival. When you bought a ticket to a Phillies game or an Eagles game or a Flyers game or a Sixers game, there were certain kinds of things that you had to understand. It's the same when we go back to live events and our patrons. Communicate what you're doing and be consistent in your messaging. What do I expect? Okay, here's a really, really good example, and it's not event specific, although it is. I am getting on an airplane on Thursday for the first time since February 27th of 2020. I am so excited, I can't begin to convey to you. I got an email today from both the hotel that I am staying at and the airline on which I am flying, telling me what to expect when I get to the airport, what to expect when I get to the hotel lobby. So they are messaging to me in advance of my arrival, pre-event, during the event. So again, translated to that world of travel. On the plane, I am sure, because as of today, they are still having to, you have to wear a mask on an airplane. I'm sure that would be messaged to me. And then when the event is over, when the travel experience is over, I want to convey to my patrons, how was the experience? The how did we do question, okay? So recognize that we have to be communicating all of the time, and our messaging has to be consistent. So as we start to open up, are there legal and insurance concerns? And as I said in my disclaimer at the very beginning, I am not an attorney. I am not an insurance agent. So if you have specific questions, I can answer some of them during the Q&A and certainly during our office hours. And that link is in the chat. So please feel free to join me either for questions and answers or office hours. Some of the things we have to think about: what are the contractual implications if we move ahead and need to change our capacity or cancel an event because of an outbreak of COVID, for example? If someone claims they got sick at my event, my venue, or my small business, am I liable? And the third big thing is, can I get COVID-specific insurance? So we'll go back and look at this, and we're going to talk a lot about some of the contractual implications on the next slide or two. But if somebody claims they got COVID at your event, are you liable? It's hard to prove it, because in the world of negligence, and again, not an attorney, but I do a lot of legal testimony and work with lawyers a lot. There's this concept of proximate cause or causality, which talks about the fact that in order to prove that, I have to prove that I directly contracted it from your event, which means I would have had a quarantine for 10 to 12 to 14 days before your event, gone to your event, come home, and then quarantined again. Then if I got sick, I might be able to prove it. And one of the things that lawyers like to say, again, not one of them, but I work with them a lot, is maybe, and it depends. Okay? And then can you get COVID specific insurance if you didn't have it prior to March 10th of 2020? Probably not. Okay? So some of the things we look at, there's this concept in the legal world of something called force majeure, which is also referred to, as you'll see in the very wordy slide, not going to read it to you, an act of God. Something unforeseen, something that you cannot have counted on. A pandemic, for example. Who counted on the pandemic? Nobody I know. Okay. So as we go forward in our contract, when it comes to this clause, there's going to be some changes going forward. Specific language. Okay, if you look at this clause, let me go back up here, it does say epidemic or pandemic. Going forward, it may say coronavirus or similar virus pandemic. Specific. The more specific your contract can be, the more protected you are. And recognize that contracts and insurance and any of the stuff we've talked about today or will talk about in the next 10 or 15 minutes, none of this prevents you from being sued, because in the United States of America, anybody can sue anybody over anything. Okay? So recognize all of this stuff helps protect you from losing a lawsuit, not from being sued. Okay? So as I said, some of the updates, language is going to be very specific. Epidemic, pandemic, contagion, say the word coronavirus. Okay, or COVID-19 or whatever, you know, COVID-19 or COVID-19-like virus, okay? Was the event unforeseeable? So if somebody comes to your event now, there is a chance they could get COVID. You can't say it's not foreseeable. Again, if your event takes place after March 11th of 2020, I said March 10th, it's the 11th, recognize that now it's not unforeseeable. Is the direct cause of non-performance. If it's indirectly caused by COVID-19 or impacted by other factors, then it might not be enforceable. And can you prove that performance of your contractual obligations are indeed impossible? If it's more expensive or inconvenient, it might not rise to the standard. So a really good example of that is if prior to March 11th of 2020, you had booked a wedding venue for, let's say, for the sake of argument, December of 2020. And you obviously could not have that wedding at that venue. Did they cancel it and give you a refund? Or did they postpone it and not give you a refund? Two really different things. And a lot of venues have had a lot of controversy because of that. Canceling or postponing, two different things. So some of the things we're going to see in contracts going forward, what has the venue changed to their services and facilities because of COVID-19? Because even when we come out of this, most of your stakeholders still want to know the type of cleaning that you're doing. Again, I got an email today from the airline I'm flying and the hotel that I'm staying at talking about what that means. So this hotel that I'm staying at has reduced housekeeping. So they are not coming into my room unless I specifically request that. They are not replenishing towels unless I specifically request that. And in this particular hotel case, it says if you request towels, they will come delivered to your room wrapped in plastic. Okay, which means theoretically nobody has touched them. Okay, so people are going to want to know what you're doing. How frequently are you cleaning your public spaces? How have you ensured that your employees and service providers are tested or are vaccinated? What are the physical distancing regulations? And if I am booking an event at your venue, is my event the only one there, or are there others? So these are just samples of things we're going to see going forward. So this is a really important slide, and yeah, I know it doesn't have anything on there yet, but this is the big E, enforcement. So let's say we've done all of the stuff that I've talked about. Let's say that I decide that my venue is still going to require masks, that my venue is still going to require physical distancing of, let's say it's reduced and it's 3 feet, whatever. If I do not enforce it and something bad happens, I am liable. This is the same concept as it was before the pandemic. So let's say that my policy says nobody can come into my venue with their own alcohol. Okay, and that's pretty much the case unless it's a BYOB kind of place. Most venues, most restaurants, most bars don't let you bring in outside alcohol. So let's say that security was lax and in my backpack, they didn't check it. I'm never going to be this person, but let's say that this patron walked in with a bottle of their own tequila, and this patron gets drunk, and this patron punches somebody out at your event, and this patron never bought a drink at your event. They brought their own liquor in because it was lax enforcement. I am probably going to lose that lawsuit. Now, if they got drunk on booze that I sold them, that's a different conversation. And yeah, I'm probably going to still be liable, but my liability might be reduced. So if we say it, if we message it, if we communicate it, it is our absolute 100% responsibility to enforce it. If we are not doing it, don't say we're doing it. And this is across the board. Anything associated with risk reduction. So I've talked now for getting close to an hour, 50 minutes. Hopefully you've learned something from it. But how do I make reliable decisions? Literally, things are changing every day. So what you have to do is pay attention to the science and the scientists. I'm not one of those, as I said at the beginning, but I believe in science. I believe if epidemiologists tell me it's okay, I can make an informed decision. Throughout the course of the 14 months, I have gotten my statistics from science. I have subscribed to the Johns Hopkins University blog. I have looked at what the CDC says. I listened to, there's this awesome epidemiologist at the University of Minnesota. I subscribe to his blog. I want to make my own informed decisions based upon science. And I recommend you do the same thing because the rules are changing literally on a daily basis. As I said, I gave this presentation 4 weeks ago. The rules were completely different. If I have to give it in 2 weeks, the rules may be completely different again. So pay attention to the science. Like it or not, you have to pay attention to what the local governments are saying, because again, at the end of the day, they are the issuers of permits and licenses. And unless you own your own venue, guess what? They can still restrict access. There's been a ton of lawsuits over the past 14 months about this is my private property. I can do what the heck I want to do. No, you can't. And yes, you have personal freedom, but if you are bringing customers onto your site, local government has the jurisdiction. There's a bar in New York, in Staten Island, one of the boroughs of New York, that has been sued probably every 15 minutes because that bar owner has decided he can do what he wants to do. No, he can't. There's a gym in South Jersey that's done the same thing. I don't care what your restrictions say. I'm going to let people come to my gym and work out. No, you can't. Okay? So again, we have to pay attention to what local government says and recognize that local government in the city of Philadelphia means the city of Philadelphia, not the Commonwealth of Pennsylvania. Individual jurisdictions. I've had this conversation many times over the past couple of weeks because one of the areas that I'm consulting on with the flower show is their vendors, their marketplace. And we've had vendors say, I've done shows in Harrisburg and I've done shows in Pittsburgh and I've done shows in Virginia. I don't care. Say it very nicely because I'm a nice guy, but you are not in Pittsburgh. You are not in Virginia. You are not in Harrisburg. You are in Philadelphia. So in Philadelphia, the board of the Department of Public Health and the mayor are the ultimate arbiters of what you can and cannot do. So make sure you understand local government and what that means. Do your homework, do your research, learn more. In this industry, you will never stop learning. My undergraduates hate to hear me say that, some of whom who graduated in person, a week ago. They don't want to hear that they have to keep learning. In this industry, you have to do your own homework because it changes literally every day. 3 or 4 weeks ago, I took an online course. It was a 3-hour course, the most boring course I've taken in a really long time because they literally read the slides and didn't say anything else. But I now am a pandemic compliance advisor. So everything I learned 3 weeks ago has changed. So I'm doing my own homework. I'm learning what today's regulations are. I am very actively engaged in reading stuff, talking to my colleagues, and trying to be as educated as I can be. I talk to my colleagues all of the time. My colleagues in Philadelphia, my colleagues in Pennsylvania, my colleagues around the country, and my colleagues around the world, because I want to see how their events are going. Were there any issues? Were there any problems? Did things go smoothly? Because again, I am constantly educating myself, and I ask you to do the same thing. You can always talk to me. My contact information will be up on the last slide. Reach out to me if you have a question. If I can't answer it in our 30-minute Q&A after this class or in the 2-hour office hours, you can always reach out to me. Everybody in the world has my email and my cell phone number. So here's just a list of different resources. That's the Pennsylvania government guides. That's the Philadelphia government guides. This is a 2019 thing, but it's been updated. Okay, you still click on it and you get there. The media screen steps one, that link is from the state of Maryland as to how they're opening up their parks. And then the state of Minnesota has their own capacity calculator, which literally changes on a day-to-day basis. So to close us out, we're just about an hour in. 2 things to keep in mind. Hope is not a strategy. Okay, they equate it here, they attribute it here to Vince Lombardi. I'm not sure if it was Vince Lombardi. I've heard it said by a lot of different people, but I use this quote a lot. Hope is an important thing to have. And quite frankly, hope is one of the few things that has gotten us through the past 14 months. I hope it gets better. I hope we get through this. I hope none of my friends and family get sick. But that's not a strategy. It's important to have hope, and hope is what keeps us going. But hope doesn't doesn't give you a strategy. It doesn't give you a business plan. It doesn't give you a risk management plan. So I have said to my colleagues, literally since day one of this thing, plan for your opening. Can't tell you when that opening is. But if you've not planned for your opening and the government says on Monday, woohoo, let's open, you're not going to be ready, no matter how hopeful you will be. And the second thing to recognize is you are not alone in this struggle. Somebody much smarter than I, said this months and months and months ago. We are not all in the same boat. We are all in the same storm. And is it a cliche? Absolutely, it's a cliche. But it's also a cliche that makes a lot of sense because each of our individual boats is different. I'm a university professor. I never lost my job over the course of the 14 months. I consider myself, that's not smug, that's lucky, that's fortunate. I have a lot of friends whose boats are very different, who lost their jobs, who went on furlough, who are surviving on PPP loans and unemployment insurance. The storm is the same. The pandemic was universal. It was global, hence the use of the words global pandemic. So the storm was the same, but the boat was different. But recognize that in this industry, there are lots of people going through what you're going on. It was the whole concept back in April of 2020 when a group of people got together and said, hey, the SBDC folks came to the School of Sport, Tourism, and Hospitality Management and said, we're getting a lot of questions from people who are restaurant owners or venue owners or gig workers in this environment or work in this industry. What can we do together to come up with ideas to help them get through it and to show them that we are not alone? That's what this center did and continues to do, okay? And as I said, if you, again, we covered a lot of stuff in an hour. If you want a more in-depth look at this topic or any of the topics that any of my colleagues are presenting or have presented through this series, take a look at our Event Leadership Certificate program. It is a fully online program, which has a bunch of requirements, but really goes in depth to a ton of topics that we've talked about. Again, I spoke for an hour. We have a 3-hour risk management class and a 3-hour crisis management class. So again, any of these topics you can get more information about. If you have questions about this topic or the event leadership program, or just want to chat me up and have nobody else to talk to, that's my email address. That's my cell phone number. Please feel free to reach out to me at any time and I will be glad to try and answer your questions. So that takes us just to an hour. So if you do have any questions, now would be an awesome time to just pop it in the chat, and I will try and get those answered for you.
Thank you, Ira. And yeah, now is the opportunity. If anybody has any questions, please feel free to use the chat box or use the Q&A function. I have posted some resources in the chat box. So one is a survey that we'd really love for all of the participants to take. And also one is some information to connect with Temple's SBDC, some extra resources. They'll connect you with a consultant if you'd like to work one-on-one. So those are some excellent things to use there. All right, well, if there are no further questions, I'm just once again going to post the link to the Zoom office hours. So anyone can register for that and join us. And you can ask questions directly to Ira if you have any. But otherwise, we'll hang on for a couple more minutes for any lingering questions. But if anyone needs to leave and get on with their day, you are welcome to do so. So once again, thanks so much for joining us today.
Get a lot more questions when the weather is lousy outside, which is not today. I can't say I blame people.
All right, well, then we'll just see anyone that wants to join us at 3:30, and thanks so much for joining us.
And you're welcome, Galaxy A10-8. My pleasure. See you a little later, Olivia.
Bye.
Thank you.